you guys know that you can have your gallbladder pulled out through your vagina? Well, I can't because I don't have a gallbladder. Now, before I tell you about that, let me tell you about this guy. This is Karl Langer. He's an Austrian anatomist who discovered what we now call Langer's lines. And Langer's lines, or what we call cleavage lines or tension lines, are this ideology that the collagen fibers making up the dermis, a lot of them run parallel to one another in certain regions of the body. Now, the dermis is dense, irregular connective tissue, so by definition, the collagen fibers run in different directions, but in certain regions of the body, they run parallel or mostly parallel to one another. And when we discovered that, we found that if we actually make incisions parallel to those cleavage lines or those Langer's lines, the collagen fibers are pulling parallel to our incision rather than perpendicular, and they're not pulling that incision open. So when we make the incision parallel to these Langer's lines, it actually reduces scarring. Now, in our ever hunt for beauty, we wanted to reduce scarring even more, so we developed things like laparoscopic surgery. So in order to enter the abdominal cavity or the peritoneal cavity, instead of making large incisions, now we can make really small incisions, insert cameras and tools, things like that, through various ports. But this continuous hunt for beauty said that these even small incisions for laparoscopic surgery that are almost non-visible are still too much, and they're not as aesthetically pleasing. So we needed to find new ways to enter the abdominal cavity. And that's where natural orifice entry became a thing. So we can go in through the nose, we can go in through the mouth, and yes, we can go in through the vagina. So we'll go in through the vagina, come out through the uterus, and that's how we enter the abdominal cavity. Now, according to this study, it's actually found that a transvaginal cholecystectomy, it does take more time, but the patients experience less post-operative pain. Now you know. Later.